Hello, everyone. Welcome back to the Montana Farm Bureau Field Notes podcast. My name is Haley Drugsma, and I'm back today with another episode of our special podcast series this week for the American Farm Bureau's ASAP, or Agriculture Safety Awareness Program Week. Today's theme is Know Your Numbers. It's no secret that farmers and ranchers are fluent in numbers. We know our stocking rates, we know our yield averages, we know that number on the rain gauge, input costs, pregnancy rates, weaning weights, and market swings. We track performance because performance determines our sustainability as families, neighbors, and an entire industry. But here's the question I want to pose to our listeners today. Do we know our own numbers with the same level of attention? Our blood pressure, our cholesterol, our blood sugar, our resting heart rate, our stress load? Because the most valuable asset on any Montana farm or ranch is not the land or the livestock, it's you. And this conversation isn't hypothetical. In Montana, heart disease remains the leading cause of death. Cardiovascular disease consistently ranks at the top for mortality statewide. High blood pressure, often symptomless, is one of the primary drivers. Roughly 1 in 3 Montana adults has hypertension, and many don't even know about it. Diabetes is another growing concern, particularly in rural counties where access to preventative care can be limited. Prediabetes often goes undiagnosed for years, quietly affecting energy, weight, and long-term health. And when you look at Montana's geography, the challenge becomes even clearer. Many of our producers live 30, 60, even 100 miles from the nearest hospital or primary care clinic. In some counties, there are fewer than 2 primary care providers serving the entire population. Add to that the physical demands of agriculture, long hours, heavy lifting, high-stress seasons, and you have a population that works incredibly hard but often delays preventative care. We push through drought, we push through harvest, we push through calving, but heart disease and metabolic conditions don't respect busy seasons. That's why knowing your numbers matters so much here. So, what numbers should we know exactly? If you haven't checked recently, here are the basics every producer should be aware of. Blood pressure, fasting glucose, A1C, full cholesterol panel including HDL, LDL, and triglycerides, weight, waist circumference, and resting heart rate. These numbers can help you understand what's happening long before symptoms appear. High blood pressure is often called the silent killer for a reason. You can feel completely fine while damage is quietly accumulating. Elevated blood sugar doesn't always make noise either, but over time it impacts circulation, energy, cognition, and cardiovascular health. In agriculture, we believe in preventative maintenance. We grease fittings before they fail. We test soil before yields drop. We vaccinate livestock before outbreaks spread. Our own health should be no different. There's even another layer to this conversation. Producers face unique stress patterns: market volatility, weather uncertainty, regulatory pressure, generational transition, debt load tied to land and equipment. Chronic stress elevates cortisol. Elevated cortisol affects blood sugar and blood pressure. Over time, that stress chemistry compounds. Montana also consistently reports suicide rates above the national average, especially in rural communities. That reality reminds us that mental health metrics matter too. How many hours are you sleeping? How often are you feeling overwhelmed? Are you carrying stress that never fully resets? Knowing your numbers isn't just physical, it's emotional and mental as well. Now let's talk about what Farm Bureau can do to help. The Montana Farm Bureau Federation exists first and foremost to advocate for producers. Property rights, water rights, regulatory reform, and protecting agricultural livelihoods. But advocacy also means strengthening the people behind the operation. Through membership benefits, producers may have access to telehealth services that reduce long drives into town, health coverage pathways designed with self-employed families in mind, prescription savings programs, and preventative wellness discounts. For rural Montanans, access is often the barrier. When the nearest clinic is an hour away, it's easy to delay appointments. Telehealth reduces that friction. Prescription savings ease cost concerns. Coverage options make screening more realistic. And those practical supports make it easier to actually check your numbers and act on them. With the Virtual Care RX member benefit, you can receive access to more than 1,100 acute and chronic medications at no cost, plus access to free virtual primary care and urgent care 24/7, 365. Prices start as low as $20.65 a month with your Farm Bureau membership. When a producer experiences a health crisis, it doesn't just affect one individual. It affects the operation, it affects the family, it affects employees, it affects succession planning. Here's our Montana Farm Bureau Membership Benefits Coordinator, Rikki Swant, to tell you about some ways that your member benefits can help you in your preventative healthcare journey.
Today, I want to talk about one of those Montana Farm Bureau member benefits that people tend to skim past, but honestly, it's one of the most impactful. It's our partnership with Lifeline Screening and why taking a little time to know your numbers matters more than we think. If you're like most of us in agriculture, your to-do list is packed, the seasons never slow down, and it's really easy to put your own health at the bottom of the pile. But here's the thing. Preventative health isn't about adding one more chore to your day. It's about giving yourself a quick snapshot of what's going on in your body before the little issues turn into the big ones. When we say know your numbers, we're talking about simple, important health indicators, things like blood pressure, cholesterol, blood glucose, and screenings that can check for stroke risk or heart health concerns. These aren't tests that you need only when something feels wrong. These are the numbers that help you stay ahead of problems. That's where the Lifeline Screening member benefit comes in. As a Montana Farm Bureau member, you get discounted access to a variety of these preventative screenings. And this is the best part. They bring these services right into our communities. So instead of planning a trip hours away or putting it off for the 10th time this year, you can be screened with painless, non-invasive ultrasound technology for stroke, aneurysms, and heart disease at a local event in a little over an hour. These healthcare professionals use the latest technology to provide hospital-quality preventative screenings that are reviewed by board-certified physicians, who will provide you with results so you and your doctor will have the information you need to work together towards improving your health. It's all about giving yourself peace of mind. Maybe everything looks great and you can keep moving forward knowing your health is on track. Or maybe the results help you catch something early and give you a chance to address it with your doctor before it becomes serious. We spend so much time taking care of our land, our livestock, and our families. Taking an hour to check in on your own health is a small investment with big return. And because this is a Montana Farm Bureau member benefit, it's more affordable, more accessible, and designed to support the people who keep agriculture moving. So if you haven't looked into Lifeline Screening yet, or if it's been a while since you checked your numbers, this is your friendly reminder. Future you will thank you for it.
In agriculture, continuity is everything. Health disruptions ripple outward quickly. Prevention protects productivity. Get 4 screenings for just $135 and receive a free osteoporosis risk assessment. We have a few Farm Bureau members from across the country here to speak to their Lifeline screening experiences.
Hi, my name is Cindy Smith, and I'm a member of the Farm Bureau of Floyd County. I'm on the Women's Committee, and my husband and I are on the boards of directors. We have a cow-calf operation. We encourage people to do the Lifeline screenings because it's not hard to do. It doesn't take up much time, and the benefits from it are amazing. And it's not like going to a doctor. And the things that they do would cost a whole lot more in a hospital. And I always feel really good when we go and feel like we have been checked up quite well.
I'm Glenn Graham from Clintwood, Virginia. Here to talk a little bit about the Lifeline Screenings program with Farm Bureau. And they have a program where you can get 4 vital screenings, and most of these has to do with heart disease and stroke possibilities. They also have osteoporosis risk that you can get for an extra $10 on that. Now, these programs have benefited my wife and myself very much because about 5 years ago, she went through this screening, and it was discovered that she might have problems with aneurysms and recommended that you go see your local doctor, and did so. It makes you feel good if you take this screening and you find out they don't find anything wrong. That's worth $150. So I've done that a couple of times. And the last one, of course, I had the osteoporosis risk. So it's a win-win either way that you go with it.
Thank you to those awesome members for sharing their stories. So here's the challenge during Agriculture Safety Awareness Week. Schedule a screening if you haven't had one in the last year. Check your blood pressure. Request a metabolic panel. Review your numbers with your provider, or have a conversation with your spouse or family about health goals. If we can schedule equipment maintenance, we can schedule preventative care. And if you're a young producer listening, start now. Healthy habits compound just like interest. Stable metabolic health at 30 matters at 50. Stress management today protects longevity tomorrow. Montana agriculture needs leaders who are healthy enough to stay in it for decades. At the end of the day, stewardship is what agriculture is all about. We steward land, we steward livestock, we steward water. We must also steward ourselves. So as we recognize Agriculture Safety Awareness Program Week through the American Farm Bureau, take the theme seriously. Know your numbers, because the most valuable asset on your operation isn't a tractor, a pivot, or a pasture. Again, it's you. Thanks for tuning in today, all you lovely members of the Farm Bureau family. We'll catch you in the next one.